Oh, sorry. Oh, sit down and look at the camera. Okay.
Yes, please.
What can robotics offer that the best heart surgeons can't? Now, that's a great question. I would say that robots are just a tool that allows good surgeons to do a really precise job inside a much smaller incision deep inside your heart. It gives us this amazing 3D view of the heart and allows us to be super precise without making large incisions to get there. And the important thing for you is that that gives you the great long-term outcome of surgery, but with that really rapid recovery. Too long?
No, it's perfect.
Okay. How can an incision the size of a dime somehow fix my heart? I'd say that the incision is the least of it. What's fixing your heart is probably 3 to 6 hours of work within that incision. And the things that allow us to do that super safely and super precisely are robotic instruments, 3D cameras that allow us to see everything really magnified and be really precise, and then a whole array of technology and machines that allow us to image things and work within that tiny little space so that hopefully you can make a faster recovery with the same great surgery.
Yeah, got it. All right.
Okay, so is my heart like a pump or an engine? I'd say both. It's a really important pump. It literally just does that all the time. But it's also an engine that drives all of the blood around your body about 8 pints a minute, every minute of the day for your entire life. That's one of the reasons why making sure it's got its own fuel lines clear, so your coronary arteries are open, that there are no obstructions to flow through it, and there's no leaking, so it's working as efficiently as possible. So a lot of what we do in heart surgery is fixing the valves inside the pump, making sure the engine's got its fuel lines, and hopefully ensuring that the whole thing lasts you not just 5 years or 10 years, but lasts you 50 years in a lifetime. That's it. I know what else to say about that one. Because it's literally a pump, it just does that. I feel like the game has changed so much for heart surgeons in the last decade. What's next? I think that AI has a huge part in improving our ability to diagnose, prevent, and treat problems, and it's rapidly becoming a key part of improving what we do in the operating room. Right now, we see that in terms of how we analyze images and data, and ultimately, I suspect that AI is going to guide a lot of what we do in real time as surgeons. A combination of the huge advances that we've seen in technology with the huge experience we have collectively should allow us to do the operations that we do in a way that is perfectly safe and virtually risk-free.